Welcome back. The future of X-ray technology has landed in Namibia, promising to revolutionize the way radiology is carried out. In 2021, Uni Medical Supplies secured a tender with the Ministry of Health to supply this unique and advanced technology to the Namibian market, where the use of AI and phototech can be used to assist medical professionals remotely in the radiology field. Now, to discuss this with us, we're joined by Mr. Wessel Burger, who is the Managing Director of Uni Medical Supplies. So, Wessel, good evening, and thank you so much for joining us.
Thank you very much, Nina, for having us.
Tell us a bit about, the collaboration between Uni Medical Supplies and Fujifilm.
So, Fujifilm is, as you mentioned, is a film company from the beginning, back in the day of 8mm film. And as you can imagine, film has quite a big use in the medical field with X-rays, which traditionally was done on traditional X-ray film. And as time progressed, they did a lot of development, and they were the first creators of digital film detectors. Nowadays, X-rays are done fully digital, so no more film. And they actually quite a big contributor to the medical industry with X-ray equipment, MRIs, CTs, etc. And Uni Medical Supplies, being a medical supplier in Namibia, thought of partnering with Fujifilm because of the innovations and the innovative technologies they can provide in Namibia.
Interesting. In layman's terms, help us understand what RIS and PACS is.
So RIS and PACS, to explain the acronyms first, is Radiology Information System. And it is what it says. It stores patient information. When the patient gets to there, the records are recorded, the requests from the doctors are recorded, the reports are recorded. The PACS part of it is picture archiving system, so that's used to store the images that is taken in the department. So when a patient comes in, his study is requested by the doctor. The radiographers in the department takes the images, the X-rays or the MRIs or the CTs, and this is then stored on PACS. And then the doctor can log back in, he can report on the images, and then the report again is stored on RIS. So it's a record-keeping system, and these are backed up on servers, so that when a patient comes back at a later stage for a second study, or has had treatment and they need to see progress, the doctor can recall the images, and they can see what the progress was. So that's in essence what RIS and PACS is.
How will this system practically, assist with medical services in Namibia?
So traditionally in Namibia, how it works, let's take an example for a patient that's in Rundu. So the patient goes to the hospital, he has an ailment of sorts, he goes to the emergency department, they send him for imaging. So he goes for a CT scan. Traditionally or historically, he goes for the scan, the images are printed to film, and a report is created, or a doctor looks at the images and said, okay, this patient needs to go to Windhoek for extra treatment. Or he doesn't know what's wrong, and he sends the images to Windhoek via courier.
To get a second opinion.
To get a second opinion in Windhoek. And what happens a lot of the time is patients, when traveling, they lose their images. Then they come in Windhoek, then the doctors don't know what to do, then they have to rescan the patient, as an example. Now, with the introduction of RIS and PACS in our national health system, when the patient is scanned in Rundu, a doctor in Windhoek, a specialist in Windhoek, can already immediately review those images without the patient needing to travel, without physical films needing to travel.
Without couriering it.
Without couriering it. So the patient can get his diagnosis and subsequent treatment much quicker. So in essence, that is a big part of what this does for Namibia. And the system that we've implemented with Ministry of Health connects the 5 big hospitals, Oshakati, Rundu, Ononjokwe, Windhoek and Katatura. And all these images are stored centrally in Windhoek with disaster recovery as well. So these images are kept for extended periods of times. So when a patient comes again and he has had treatment, say for instance you've had cancer and they've been giving you treatment and they go for a second scan to see what is the tumors doing, the doctor can immediately call it up and he can compare the current images with the past images. So that's one of the big benefits that it has. So it gives the patients in the remote sites access to second opinions, to specialists based in Windhoek. And then, of course, there's the artificial intelligence component.
Yes.
Now, I know that's a big buzzword lately, and artificial intelligence is everywhere. But in imaging, artificial intelligence is a tool that helps the doctor zone in on the problem much easier. To give you an example, our artificial intelligence that is implemented live on the system currently for chest x-rays. Any patient that goes into these 5 sites for a chest x-ray will automatically be screened for TB. So the system will automatically detect anomalies for TB, and this is one of 34 different anomalies that the system can detect just on a chest x-ray. It's automatically flagged to the radiologist as there's a possible finding here.
Right.
He can quickly open it and verify it. And as a result, more patients can get, number one, diagnosed quicker and get treatment quicker. Also for emergency medicine, if a patient comes in for an MVA, as an example, and he has a punctured lung, it can detect it and it can immediately tell the emergency department, listen, this patient needs urgent care. So that's what artificial intelligence does for the system.
You mentioned 1 out of 34 anomalies that the system can automatically detect.
Yes.
TB being one of them. I understand scanning for cancer is also another.
There's cancers, there's different types of pneumonia, there's voids, there's nodules in the lungs, there's, as I mentioned, punctured lung, broken ribs. I can pull out some medical terms in the thorax if you like. So there's quite a big number of things that it can detect. And in addition to the chest x-ray, Ministry has also acquired mammography AI. And this is quite significant because what it does is it automatically screens any mammography patients, again, for nodules and tumors and cancers, and it automatically flags it with the radiologists. And being Namibia as it is a small country, well, not a small country, but not a lot of people compared to other countries, specialists are in high demand. And Ministry, there's not enough specialists in the country. And this tool helps the specialist focus on the images that actually need attention.
You mentioned that it will be across all the 5 main hospitals within the country. So how do we access it? Is there a special piece of equipment that needs to be installed?
So what we did, what the system entails basically is we've installed very high-end servers in Windhoek, in the main server rooms with obviously off-site backups. And then the Ministry of Health has an internal hospital network that's used with this system to communicate with Oshakati. So for instance, an X-ray machine in Oshakati is connected to the hospital network, and that transmits images to the servers in Windhoek. Then we've also placed workstations for doctors, both diagnostic workstations which they can use to do reporting, as well as workstations for the staff in the departments to enter patient data and to manage the workflow in the departments. And this is all done within the hospital network connected to servers in Windhoek that is backed up.
And what would the cost of something like this be? And of course you have to look at the upkeep as well.
So this system, and as you might know, any computer system ages with time. A lot of software makes use of licensing that expires in time. This is not the case here. So the licensing that the ministry purchased in this system is once off upfront. So the total cost of the system that they implemented is about 25 million. And it's a massive investment into healthcare in Namibia because it really does make a difference if you just think about transporting patients to Windhoek for second opinions. It really does cost saving at the end of the day. As far as maintenance, it's all included. For the next 6 years, there will be no costs involved with the system. So it's an upfront investment. And then in 6 years, one has to start looking at upgrading the hardware because storing images fills up the storage that's available. And if you want to continue adding images, you'll have to look at expanding storage. So after 5 years, they're going to have to start looking at upgrading and replacing physical computer hardware. And of course, this is only the first 5 hospitals to start with.
So there's an expansion plan for this?
I'm sure the ministry does have expansion plans. Look, it's the reality of the fact that imaging is digital, and connecting more hospitals to the main system makes sense, because this benefit that they're having for the 5 main hospitals now can be extended to all the hospitals at the end of the day. So ministry will probably have expansion plans, and as expansion plans happen, obviously storage needs to be upgraded to be able to house more images, because it's serving more patients. And this will also then increase the longevity of the system, because the system is constantly upgraded to add storage, to add sites to the system. So it is an investment, but it's a big investment in e-health, and e-health is what's going to make more efficient healthcare for all Namibians.
Have medical personnel been trained yet on how to use this?
Yes, so this was actually quite a big endeavor to install the system. We had a team of 10 people, of which 4 people were Namibian based, that has been previously trained as well. And then some people from South Africa, and also some people from Fujifilm based in Dubai. And we spent about a month from site to site training the people, making sure they know how to do it. There's also follow-up training from our local team from Uni Medical Supplies that keeps following up with the sites, keeps going back, keeps training the people. So everybody's been trained, and the system is currently full live and working quite well.
And currently being used nationally?
It's currently being used nationally, yes.
Fantastic. What's the feedback been like so far?
So the feedback has been quite good. And what's one of the things it's hard to explain, but because there's different people using the system on different aspects. If you take it from a radiographer's point of view, for them it's just putting in data and saying, okay, this study started, and this study is ongoing, and this study is completed. So for them, it's not necessarily such a big deal. However, if you take it to the doctor, and the doctor is able to access that image and report that image, and call a doctor at a different site and say, listen, I've looked at this image, can you please look in more detail? The effect is much bigger. And at the end of the day, the patient is much happier, and the doctors that requested the images are much happier, because of the advanced features. The reporting doctors can do more with less time.
Yeah.
So the feedback has been quite positive in all aspects of it.
Fantastic. Well, Mr. Burger, that's all the time we have this evening. But thank you so much for joining us. Thank you. We're going to take a brief break. We'll be right back.